Are you suffering from irregular periods, having a frequent acne outbreak, increase in your bodily and facial hair, having a considerable weight gain, having blackish discoloration on your neck, and are you looking for a cure? Hi everyone, this is Dr. Sneha, I'm your homeopathic doctor, and all are welcome to my YouTube channel. I have seen a lot of ladies book appointments, get a lot of treatments for PCOD. They have taken a lot of medications, prescriptions, and yet their PCOD complaint is not yet cured. Many women have undergone surgery thinking that they might not be able to conceive because of PCOD, and what the society might tell them that you are unable to conceive, and so on. In this video, I'll be telling about PCOD, what are its symptoms, what are its causes. I'm going to bust some myths and misconceptions that people have about PCOD. I'm going to tell you the homeopathic treatment of PCOD. And also, in this interesting video, I'm going to tell you about one of the cases of PCOD that got cured using homeopathy. So let's talk about what is PCOD. So the first thing people do is Google it. First option is Googling. Go to the Google search, type PCOD, and bam, there you have hundreds and thousands of search results. The second option, if you have irregular periods, excessive of body hair, weight gain, you go to a gynecologist, you can appoint, go there, have an appointment, discuss, and then your gynecologist just says that you have PCOD, right? So this is the drill that every woman has gone through. So now let me tell you what is PCOD. Like, you know, the abbreviation is polycystic ovarian disorder, right? So every month a matured egg or ovum, that we call, is supposed to reach the fallopian tube. Right? So every month, either from the right side or left side, one of the egg is supposed to reach the fallopian tube. If it does not reach the fallopian tube, and if the egg is immature, and if it stays in the ovum itself, it does not reach the fallopian tube, it forms a cyst. It forms a cyst in the ovaries. This is called as polycystic ovarian disease. Now, what are its symptoms? Like I said, you are having excessive bodily hair, weight gain, acne outbreaks, having a blackish discoloration on your neck and elbows. So these are the symptoms of PCOD, right? So now we are going to talk about the causes of what are its causes, how PCOD is caused. So the first and the important reason that every gynecologist, every doctor will give you is the hormonal imbalance. How hormonal imbalance is caused, right? What regulates, what controls hormones is also necessary. So I'll be telling you about all of these in this video. There is something called as the HPO axis, which is also called as the hypothalamus pituitary ovarian axis. Hypothalamus and pituitary both are located in the brain. Hypothalamus is located in the base of the brain, right? Right next to pituitary, it is located. Pituitary is nothing but a pea-shaped gland, right? So hypothalamus controls the releasing hormones, like thyrotropin releasing hormone, gonadotropin releasing hormone. So it controls the releasing hormone. Like a tap is opened and the water flows. Something like that. The control. It releases hormones and then it stimulates the pituitary gland. Pituitary gland has various, it also stimulates as well as produces a lot of hormones, like follicle stimulating hormone, thyroid stimulating hormone, luteinizing hormone. All these hormones are produced and as well as stimulated by hypothalamus. So these hormones have an influence on the ovaries. Now, because of the negative and the positive feedback mechanism of the ovaries on the hypothalamus, these releasing hormones are controlled. So these three have an effect on each other, right? Even if one organ or even if one gland loses its function, the other is directly or indirectly affected, right? So now we are going to talk about the causes of hormonal imbalance. How an hormonal imbalance is caused. The first and the foremost cause is stress, mental or physical, right? So stress has an effect on the hormonal changes. The second is the dietary intake. Whatever diet you take has an impact on the hormonal levels. The third important cause is the sleeping cycles. If you don't sleep properly on time, if you don't have a proper habit of sleeping on time, if you skip, if you night watch, if you don't have a proper schedule for sleeping, it can cause a spike in your hormonal levels. The next thing we are going to talk about is about the insulin levels. How insulin levels can affect your hormonal levels. In one of my videos on acne, how you can reduce acne, I have told about the insulin impact on the hormonal levels. Right? Because of the insulin resistance, a glucose, when we intake a lot of glucose diet, there is an insulin resistance. So this insulin resistance causes a spike in the glucose levels. When the glucose level rises, insulin level also rises. The rise in the insulin level causes a rise in the androgen levels. Androgen is one of the insulin-like hormones, right? So when androgen level increases, it causes a trouble in the ovulation process, right? Ovulation is nothing but the maturation of the ovum. It causes a trouble in that. So that is why the ovum stays immature in PCOD. The androgen level increases in PCOD, right? The next thing we are going to talk about is the myth and the misconceptions people have. The first misconception is that people think that if we take a lot of hormonal supplements, if they are advised to take a lot of supplements, they have the menstrual process ongoing, right? So now I'm going to talk about what happens in this process. What happens if you take these hormonal supplements? PCOD is not a disease, it's just a functional problem, right? So a functional problem cannot be solved by any supplement, right? It needs a functional regulation. These supplements can cause only a spike in your hormonal levels. These can cause a spike in your hormonal levels and mimic the menstrual process. The estrogen and the progesterone tablets, the conception tablets that they are advised and they are given, the ladies are given, right? These can mimic the menstrual bleeding, right? The menstrual bleeding that these women get is nothing but the endometrial shedding, right? So now I'm going to talk about the treatment in homeopathy. Homeopathy ensures a permanent cure. The functionality of the organ is restored, right? The organ is made to do its function. It's not a supplement. It restores the function of the organ or gland and makes it function normally. So, homeopathy does not even have the side effects. Right? You need not be scared that what this might cause, what would be the side effects and all, right? So now I'm going to talk about what are the treatments, what you can do, right? So many people think that it's not possible to cure in homeopathy. They have to go for surgery only. No, homeopathy is the best option. It restores your normal cycles of menstrual bleeding. Hormonal levels are normalized. So you can definitely try and use homeopathy treatment, right? So now I'm going to talk about one of my cases that got cured using homeopathy. Yeah, the lady, age of 30, right? She's a known case of PCOD. She even had a complaint of vaginal boils. She took a lot of contraceptives and hormonal supplements as usual. She had a lot of menstrual bleeding. Then she was unable to conceive. For 3 to 4 years, she was unable to conceive. After which she took homeopathy. Right? So I'm after taking homeopathy, 3 to 4 months was her duration. So for getting cured of PCOD, she took medicine for around 3 to 4 months and got cured of PCOD. Now she has a child of age 2 years, normal delivery. The PCOD got cured. So definitely you should try homeopathy and believe in homeopathy. Right? So if you like this video, do like and share it among your friends and family. And do let the persons who are suffering from PCOD know that there's a cure in homeopathy. So if you haven't subscribed to my channel, do subscribe it and stay tuned for the next upcoming videos. Right? Thank you. Thanks for watching this video.